I am based in Dubai. I've lived there for the last 4 years. So yeah, let's say, commute is different, but for me, everything is experience. So it's fine.
That's good. I think if you treat your journey like that, even a small actual journey and your kind of leadership journey as an experience, then you're always going to be onto a winner.
Exactly.
So tell me, I suppose at the start, what are you up to at the moment? Briefly, and then we'll kind of work back or work forward from kind of when you started in leadership or when you started noticing leadership, and what kind of experience you've had and how that's made you grow and evolve as a leader.
Sure. So I think I am on one of the biggest transitions in my life currently. I am establishing myself as a freelance consultant.
Okay.
Organizational transformational consultant. Actually, all my background is in healthcare. I have worked in 3 different countries, 2 continents, and I'm extremely passionate about healthcare leadership.
Okay.
This is my journey. So UK, Dubai, and recently Kuwait. And now I am back in Dubai. I can see the leadership revolution is actually happening as we speak. So I'm really excited to see how my skill set can fit in and how I can contribute to leaders developing further skills and how I can fit in myself. What else can I learn? How else can I grow?
And how are you seeing when you're saying you can see the leadership like changing and growing and transforming in Dubai and Kuwait? How are you seeing that?
So I was actually in Dubai during the COVID pandemic, and I was the key person facilitating opening of a COVID field hospital. So some of the hospitals had agreements with government, and government sponsored, let's say, provided funds, equipment, even the personnel and so on for hospitals to open extra facilities. And, to look after people who are affected with COVID.
Yeah.
So when this opportunity came in front of me, I would say everyone else probably would be scared. And when they told me, Magda, you're going to go there and you're going to do this, I was like, wow, can we please go and see this facility? Because I want to see how I'm going to structure myself, how we're going to establish everything. And then when we actually started on day 1, it was myself and 3 nurses. And then patients started coming. We were not prepared. No one knew the protocols. The doctors were asking like what tests to do, what's gonna be the follow-up, what is gonna happen. And I found myself in this position asking myself questions, what do I do now? How do I support my people? Everyone is scared, right? No one knew at that point what is COVID and where we're gonna get. So during these few months, the question of psychological safety, actually the concept, I started embracing this concept and I started looking deeper. What do I do? How I need to change myself, how I need to adapt myself so I can better serve my people. And also I need to learn from this experience. So I think, yes, psychological safety, adjusting even the level of compassion. I need to be much more compassionate in this situation because this is what my people are requiring. And also I would say compassion towards myself because I am still learning. It's a huge unknown. Let's say this was probably the scariest, the most complex situation that I found myself in as a leader. So yeah, for me, it was all positive in the end. I have learned a lot. The feedback was also good. And I think, curiosity, I think, led me to understand what needs to be done, listening to the people, and just learning. Everything is learning.
So it's quite strange that now we're kind of through COVID and things going back to normal, that you kind of forget the kind of paranoia and the fear that we all had. And, queuing for shopping in England, you had to kind of queue for the supermarket at, 2 meter distance and there's kind of 300 people in the queue to go and buy your shopping. And I was talking to a friend of mine the other week and he was in Scotland and he was coming back to London and he bought himself like a paper kind of zip up suit and a mask and welly boots to kind of get the train or something. And you kind of think that seems crazy now. And so how did you, I suppose, what was your pivot there and how did you like develop that empathy and that compassion?
I am very fortunate that I have worked with leaders who we're also compassionate. I've worked with leaders who had great empathy, curiosity for other people. So this is, I suppose, how I learned. I have worked with leaders who would ask me questions instead of tell me what to do.
Okay, that's
Of
good.
course, there were some individuals that would use this approach, but it's okay because each and every one of us is different. Okay, we learn from each other. So I needed to embrace this concept. Okay, when I'm sitting in a conversation with my boss and he is asking me questions, at the beginning I feel uncomfortable. I'm like, yeah, Magda, tell me more. Okay, how did you reach this conclusion? What else can you do? Do you think you need to be more compassionate with your people? What do you think? What kind of skills do you need to be able to fully embrace this situation? And I think slowly, and because I'm so curious, I was always questioning myself like, I've never experienced this before. How come this person is telling me I empower you? What skills do you need? How can you behave differently? So I think, yes, again, this is the curiosity that is leading me to discover all these amazing concepts and helps me grow.
So do you think that the curiosity pulls you through the like imposter syndrome? So when you're talking there and saying, why is he trusting you this? Why do they think you know this? But your natural curiosity. Do you think you're naturally curious? Or do you develop that, do you think?
See, as a coaching leader and a trained coach, I always say curiosity is a skill. So you can learn it. But I'm sure some people are born curious, and this is something, children, when they are born, they are naturally curious.
Yes.
And at some point in their lives, the school, the system, the social media, everything else comes in, and maybe we are loaded with information, so we stop being as curious as we used to before. So I think, yes, curiosity can be learned, and I have embraced the concept of curiosity during my coach training. One of the values, of coaches is to be curious. First for the client to make sure that you are gonna get the best possible result, and then you have to be curious for yourself, because as a coach, as a leader, I need to continuously grow. How do I grow? So I think number one skill, if you ask me, for me, that has taken me to all these amazing places is curiosity.
Okay. And how did your journey start then in leadership? Like at what point did you kind of either develop from maybe a manager to a leader? And where did that kind of start? And do you see a difference between, or how do you differentiate between a leader and a manager?
This is a very good question.
Yes.
Yeah, I need to look deep inside and see. So my professional journey in healthcare started in the NHS. So I have worked in the NHS for 14 years. And as far as I can remember myself, I was this individual who could manage, let's say, my own workload that was extremely complex, because I work in environments that was fast-paced, really busy, a lot is going on. So not only I was able to manage my own workload, but also I was able to support those who were around me. Let's say if there were a few other nurses assigned next to me. So I saw that myself as a highly reliable individual. So then I saw, if I have these skills, then there must be something there inside me. I did not recognize myself probably as a leader back then, but other people definitely seen it. Because my seniors tend to assign me in the most busiest, let's say, environment, because they knew Magda can handle it. Not only Magda can handle what's in front of her, but she will also be able to support others.
Okay.
Yeah.
So it kind of wasn't almost like a clear point. It was like by osmosis almost, that you'd kind of be in a position, you'd be helping people and they'd see Magda can do that. And so then slowly you kind of developed into, you already showed leadership, but slowly that, as that got recognized, the leadership values and your leadership skills became more prevalent and kind of pushed you on further. Yeah. I think this is exactly, you have just bottom lined it. Okay. Yeah. Cool. And so, and then when did it become kind of formalized, and would you then see from this osmosis that then you said, okay, now I'm a leader?
So working in the NHS, actually, when I started progressing through the career ladder, it was always my senior saying, Magda, I think you would be fit for this position. If you can handle this, you have the skills that really will help you be successful in the next position. And even though I was maybe considering applying for these positions, but I thought, no, I don't have enough experience, at least on the paper. I'm not senior enough. I'm only junior. How can I go for it? And then this, supportive voice made me go for these roles. And then I got the role. And then there's a next role. And exactly the same sentence is coming from another senior individual saying, Magda, if anyone can handle it, it's going to be you. So then I go for these roles. And when I'm actually in the role, I'm like, how did I get here?
Yeah. Yeah, no, I've often felt that when you start a new job and you first start, and you're like, oh, they're going to find out I don't know what I'm doing, that and I don't know what I'm doing, and I'm going to get sacked in 2 months, and then you kind of make it like 3 months. Actually, I might be able to do this, and then after 6 months, yeah, I can definitely do this, and after a year, you're kind of looking for the next thing. So it's strange how it kind of slowly grows, and it's that confidence and I think curiosity and I've always found that it's not being scared to ask like a silly question. So I went into construction 20 odd years ago from being in events marketing, and I'd always go onto site and I would ask why something done a certain way. And they kind of look at you like you're an idiot, and of course it's got to be done this way. But sometimes you ask that question and it makes people think, and then they decide to do it like a different way.
Yeah.
So that's great. Okay, and so you've moved, and so that's when you kind of went into the leadership roles. And how did you kind of develop your skills from there?
I think my biggest breakthrough happened when I came across a coaching leader. Okay, I had a conversation with one of the HR directors in the hospital. I was working in Dubai back then. And the way this person spoke to me, it was very unusual. She said, I empower you. You have all the tools, you have all the skills, you can handle this situation. Then we started talking more, and I found out that she is a coach. I started looking into it, and I decided to do my coach training. At the beginning, I did not know what is it gonna be like. And looking back now 4 years, this is the biggest transformation of my life.
Okay.
I developed curiosity, as I say, and curiosity helps you shift judgment, reduces the unconscious bias, and reduces the need for labeling. So this is what I've learned. And a coaching leadership style is science driven. So when we as leaders understand how people behave, why there is resistance to change, why people react emotionally to certain situations and how to deal with it, then we are at the winning position. So that's why I incorporated the coaching leadership style. And this is actually my main style, is the coaching leadership style, curiosity as a point of connection, always.
And is that, when you look back, do you think you've always, or you've had coaching style longer but wouldn't label it as coaching style, or do you think that's developed since you've done, or is it just you're more conscious now that you've done the coaching that you think, oh, I've got a coaching style, or when you have done the coaching and you realize that's what it could be called, and you look back and think, actually, I've been doing that for 14 years. How do you think that worked?
I would say there were elements like the use of positive language, the curiosity. But curiosity in the beginning was mainly to see how I need to change. So coaching made me become more curious for the other person. So I need to be curious for the human in front of me to understand why people refuse, why people say no, why they get stressed, what emotional reaction might come, and how am I going to deal with it. So I said, yes, the elements were there, but of course, the new awareness is there. And then you're thinking, wow, I've been doing some of it. But then you get all this knowledge and you get the science behind it. And when you understand it, this is the power. And we say knowledge is potential power. Only when you use it, when you apply it, and then when you teach it to others, you learn it twice. And this is how powerful the coaching became for me in my leadership journey, because I also teach it to others. If I was able to have the biggest transition in my life as a human and as a leader, why shouldn't I share this knowledge and the skills with others so people can also benefit?
Okay. And do you think that working in the kind of the hospital environment, that because I would kind of, this is like my preconception, but I would think that people who work in that environment would be more empathetic, would be more compassionate than if you worked in a bank or in finance or different kind of industries. So do you think that helped coming from that industry, that working there? Was it kind of already there to kind of nurture and to bring through?
This is a really interesting perspective you are giving me now. Yeah, as a nurse myself, yes, compassion is there, and I should be guided by compassion. But I think perhaps yes, it was there, and as you said, I was able to nurture it more. And maybe it is easier to coach in healthcare because of the values that the individuals are naturally bringing with them: compassion, empathy, unconditional positive regard.
Because I think when we started the conversation, you were describing how a doctor kind of gave you certain responsibilities and empowered you. And when you were saying that, I was thinking, yeah, actually, probably in the medical profession, that it probably is more, in some ways, you think it would be more regimented because it's kind of quite serious. It's kind of lives are at risk.
Mm-hmm.
Whereas the other way is money's at risk if you work in a bank. So maybe people would value the money more. But when you said that, I thought actually that maybe it is a kind of great fit for kind of the coaching and the empathy and kind of building people up like that. Okay. And do you have kind of, when you look back, do you have like certain doctors, managers, leaders, nurses that you kind of think, oh, they made me change how I would, made me think and think, okay, I want to take a little piece of them and a little piece of that. Do you have kind of key moments when you look back?
Yeah, I think getting feedback and giving feedback is one of the skills that is really important for leaders to grow. So I am not only a coach or a coaching leader, I am also a certified trainer. So one of my signature session on for leaders is how to give and receive feedback. And I had this particular experience recently when we were having a group coaching session with senior nurse leaders. And I found out that some of them don't ask for feedback for themselves.
Okay.
Even though they're quite senior and been in the position for several years, this is not something that they're comfortable with. Again, I assumed that because I'm very comfortable asking people, on day-to-day situations, how am I doing? What can I do better? Can you tell me how can I improve? So when I found this out, I said, okay, this is your task. Before we meet next week, you're going to go back to your departments, you're going to go back to your units, and you're going to ask your people for feedback. I don't mind how you do it. Is it verbally? Is it written? But you need to bring something next week. We'll put it on the table and we'll discuss it together. And the following week, there were some really powerful reflections from specific senior nurses. They found out from their people that their teams actually think that they are very scary and intimidating first thing in the morning and unapproachable in a way, even though these people would like to ask something, they would not because they think they will be told off or the leader is not in the mood or something is going on. And actually, when these specific head nurses were reflecting, they said, this is my normal self. I am serious. I'm trying to concentrate. I'm trying to do the schedule and, allocate tasks and so on. So when these specific individuals got these feedbacks, it was a really powerful awareness. Not only they were able to raise the confidence level because now you have this kind of information, you can do something about it. But also they were able to connect with their teams better. So the trust increased, the human skills, the actual rapport. It was something totally different. And you just needed this one question, one conversation to just change, the whole reality in the department.
Okay. And sorry to go back again then, but are there some kind of key pivots that you kind of think that did change your, because if you think when I did my MBA, I think the first question they ask you are leaders born, or do they like develop and grow? And you kind of stuck in this kind of quandary to begin with, and you kind of think, oh, they're born like that because these people are, and then you kind of think, but it's all the circumstances, and if they were kind of born to be a leader, then how come their children aren't? And it's, well, you've had to go on this journey to become this, and if you're then a leader, your children don't go on the same journey, so they're not going to be as compassionate, empathetic, passionate about things. So do you think that if you look back, when you started off in life, working life, or even younger, would you have thought this is what a leader is? And then now, 20, 30 years later, do you then think, okay, that's changed, like your perception of leadership qualities and what a leader should be?
Yeah, so I remember my first managers or leaders back in the NHS. And there was a variety of individuals, some even like a strict autocratic style.
Yeah.
And then you have the transformational leaders who are much more relaxed. They ask questions. They will say, oh, how can we do this? Let's go ask questions together. Let's sit at the table. Let's brainstorm and so on. So I think in my head, yes, I can picture these individuals, and it's not only one or two people, it's more.
Yeah.
But I think I took a little piece like of information or the way these individuals behave or values, and try to see how I can adapt it to my own individual style. And as I said, now we are in a huge leadership, like revolution time. So leadership is continuously evolving. So it is not like I have a skill set from 20 years back and I'm going to use it now, because it doesn't work like this. If we say that change is the only constant, we need to continuously adapt ourselves. We need to be curious. We need to be flexible to see how we can benefit the people around us and how we can learn ourselves.
Yeah. Yeah. No, I like to say you can never step into the same river twice, because the river's always moving and the life's always moving. And do you think, though, that the leadership in some ways has changed, or do you think we've just been able to kind of chop it up smaller and look at and blow it up and look at it more? And so there's always been elements of humble leadership, servant leadership, laissez-faire, transformational, that's always learning, coaching leadership. So do you think these have always kind of been there, but people hadn't spent the time studying, or do you think it has actually changed?
See, I believe in the constant change. So for me, there's been an evolution. There is an ongoing evolution going on. However, you need to have time to stop and embrace what is going on. And in current reality, everyone is busy and this is going on and I have to do this and I have to do that. And then sometimes we don't have time to stop and see what is going on. I mean, I've been fortunate enough going freelance recently that I really can embrace what is going on. Where am I now? What skills do I have? What value do I have? How I can best mold it into something really unique so I can grow further and I can support others.
Okay. Because in the last role you've just left, you were a director in the hospital?
Yes, I was a director of nursing in a private hospital in Kuwait.
Okay, and what's the kind of leadership things did you implement, and talk to me about that?
Okay, so I always say that everything happens for a reason and at the right time. I don't believe in coincidences in life. So when this opportunity showed up straight after I finished my MBA in healthcare management, I was thinking, yeah, this is really interesting. They were saying that they don't have corporate culture. It's a family-run business. Happiness as a value of organization, happiness through holistic approach for the patients and for the staff. So I'm thinking, yeah, this sounds really interesting. I need to go and see what's going on there. So during these 2 years, I was able to establish coaching as my main leadership practice, starting with individual coachings with communication tools, and then I progressed to team transformation coaching. So I think that was one of the biggest breakthroughs in my career. This is what I've achieved. And yes, I've achieved because actually now I had the time to sit down and look where this journey took me. And it is huge. I mean, to be able to say that I've been a key contributor to establishing this coaching culture in the organization is something really powerful. Now I'm thinking if I have these skills to engage others, because it's not only me, I cannot do anything by myself if people will not trust me and we are not going to come together. Strength is in the collective intelligence. So I think, yes, especially through coaching leadership style, team transformation coaching, organization transformation, I've noticed that, yes, I have unique skill set and I can also share it, to empower others and see how they can also maybe elevate their leadership journey and take it from there.
Okay. And tell me about, so when we were talking yesterday, you were saying about the feedback kind of program you brought in, and that was really interesting. So can you retell me and explain for everybody so that we can...
You mean how I give feedback as a leader, how I ask for feedback?
Yeah, and I think in how you were kind of developed into the team, that it was, I think you were explaining about the nurse who'd been a nurse for 30 years,
Yeah.
and she came in the morning and she didn't realize that everyone was scared to speak to her.
Yeah.
And she explained why, and she never had that feedback. You tell it better than me.
Yeah, it's really interesting actually, because sometimes we assume, right, that if we do things in a certain way, then everyone else is doing things in the same way. So I wasn't only coaching in this hospital, I'm also a certified trainer. So I was mixing a little bit of training, coaching, team transformation, and so on. So I delivered, let's say, a program, leadership development for senior nurses. And during some of the sessions, I found out that there are people in senior position that never ask for feedback.
Okay.
And that came as a surprise to me because I have developed, let's say, some powerful questions, how I ask for feedback about myself.
Yeah.
I have a habit at the end of every one-to-one, or even we have a brainstorming session, I will ask, can you please tell me, can I do anything else differently? Are you okay with my support? Do I need to step up? Do you want to see me doing something else? So for me, that was natural. Okay. I ask these questions. I make myself vulnerable. I can say, no problem. If you feel this way, I totally can embrace it, even if I upset someone or I say something that might be inappropriate for someone else. So when these senior nurses who've been in the position for like 15 years, they say they don't ask for feedback at all, I'm like, okay, let's do a challenge. So I said, before we meet on a session next week, can you please go back to your units, to your departments, and ask for feedback? The following week, when these specific nurses came with these feedbacks, actually it was like one of the biggest development point for them in the leadership journey. Because they said, I did not realize that my people think that I am scary and I'm not in the mood first thing in the morning when I come on duty. And actually, I am trying to concentrate because we have huge workload and we have sick patients and something else is going on. So this way, not only I was able to connect with them on like a human level, but also this has, let's say, raised my level of confidence. Because when you know that this is how people see you, you are able to do something differently. And then you can say, okay, I have the power to do it differently. So when you know you have the power, your confidence goes up. So yeah, never assume, actually. Never assume.
No, I think assumption is very dangerous.
Yes.
And quite often that we do like assume, and a big thing that I find is if ever I'm kind of in conflict with somebody, something is, which I don't like conflict, but whenever I'm in conflict is if you kind of step back and you look at the other person is seeing that maybe they think you're being aggressive or you're trying to take kind of things from them or how you're being. And so it's always very good to kind of almost not assume, give yourself feedback on what they might be, and then to ask, and then try to ask around that question to see. Do you find that lots of people in leadership positions can find that leadership can be lonely? Now, from just talking to you for this yesterday and today, I can't see that. My assumption would be that's not a problem for you because you kind of embrace leadership, and I can see you very empathetic, compassionate. But do you ever find that loneliness, or do you have to coach leaders? Is it like to help them with loneliness?
Yeah, actually, I've been discussing this concept with my fellow leaders, colleagues. So let's say my take on it is like if you want to isolate yourself, you can isolate yourself quite easily, especially if you are in a very senior position. But then if you are aware that actually you are not alone because you have like peer support and other people to talk to. So I say you need to make yourself vulnerable and connect. Because if you decide to isolate yourself, it's gonna be again really difficult to see yourself from a different perspective.
Yeah.
To see what else is out there that you can learn. Yeah, again, it's a skill. So
and how would you try to help people with not isolating themselves? What would
I'd say you need to feel confident in yourself. You need to feel confidence and show the vulnerability. Go and ask questions. Can we talk about this? Can you give me feedback? Like, what are you doing in your role? Start discussing. Start speaking out. Start saying, I believe that if you verbalize and you say it out loudly and you can hear yourself, there is already a power. And the other person can connect with you, with what is coming. So for me, I never had a problem.
Yeah.
I never had a problem with talking to others and seeing other perspectives because, as I said, curiosity took me places and I have always learned. I never feel comfortable enough in this position because I know that I can grow more and there are other skills that I can get and there are other situations and individuals that I need to connect to get some more learning and some more lessons.
And how do you bring that out in leader? How do you use your confidence, your curiosity? How do you kind of try to impart that on other leaders that you worked with?
So I would say curiosity and confidence, they are skills. So if you have low levels of these two skills, then you need awareness. And working especially with a coach or a coaching leader, I can evoke this awareness in others. So you need to stop, you need to embrace and see where you are. If you say that these two skills definitely need developing, then this is the starting point. So you meet people where they are and you take them on a journey. But first you need to embrace it yourself. Yes, this is what I'm lacking. I can be vulnerable to find answers and to connect with others and to ask questions.
Okay. And then, so quite a big difference between other people's experience in a way in COVID and yours is that a lot of other people would have been closed off and have to work remotely, whereas yours was the opposite and you were kind of then working like in the hospital with people day to day. And how did you find that?
Actually, I would say that we were kind of closed off because it was a COVID-filled hospital that was built in a hotel setting.
Okay.
So Dubai was on like a full lockdown, so I could only go to work and back.
Right.
And some nurses decided to sleep in the facility between the shifts because they were worried like that they will bring this infection to the family, to their children, and so on. So in a way, we were confined.
Okay.
But I believe that we did some really good work internally with the psychological safety and how we decided not to maybe listen to the news so much. We decided to carry on as normal. I think that was my winning point. We are here. We need to make the best out of this situation. We should support each other. The compassion, the empathy has to be there and carry out as normal. I think this is my biggest lesson from that situation.
And how did that work, like across like the organization and across the hospital?
I think in this particular hospital, the culture was the same because the support was huge. Even though my other colleagues were in the physical hospital facility, but
Yeah.
we had like WhatsApp groups and we had communications every single day. Then as the COVID facility grew, we started with one floor, 75 patients, and then we filled the whole hotel. So it was 4 floors,
Yeah.
okay, 75 patients on each floor. So as we progressed, I think we also upskilled ourselves with the human skill, with the compassion. We had the laugh. We laughed a lot in this facility, you know, because that was this one highlight for us. Why we shouldn't have fun?
Yeah. And what was the kind of, how did you protect each other from, I presume, were there deaths in there, or was it kind of a good recovery rate, or?
I mean, not in our hotel because the patients were mild to moderate, but yes, some of our patients got sick and we needed to transfer them out. And, you know, when you're serving, especially as a nurse or a doctor, when you're serving your patient, then you're just looking to deliver the best. And you know that sometimes the outcome, you cannot predict the outcome, especially in COVID. Everything was unpredictable in there. We did not know that the severity is going to be so high. But still, you know, if we want to give the best service, then also we need to look after ourselves. So the psychological well-being, the mental, physical, and so on. I think that was my approach. I need to make sure that my people are well enough, mentally, physically, spiritually, and then we can deliver the best service.
And you did that with communicating, making it not a morbid place to work, making it fun to
Never,
work.
it was not morbid. It was fun. Actually, my husband, I asked him, what can I do, you know, just to cheer people up. So once a week, we will bake cupcakes. And I will bring these cupcakes to the facility and I will go through all the nursing stations on all the floors and I will distribute these beautifully decorated cupcakes to all the nurses. And it was like my treat, something small that I can do. But, you know, the trust and the connection and, you know, the positive feelings, that the appreciation is also there. As I said, just to try have a routine.
Yeah.
This is normal, okay? We need to deal with this. What's going to happen later is going to happen later. We don't know, but let's...
What flavour cupcakes were they? What was the most popular one?
The most popular one. So I was decorating them in all funky colors, like even sprinkles and, you know, the fairy dust or whatever I would put on it just to make it really, really wow. When people see that, makes me feel good.
And how come you didn't bring any today? That's my thing. Me and Martin would love some of those.
Next time, let's do podcast number 2.
Okay, and then so I think also yesterday we were talking about the learning culture and the psychological safety. So can you kind of expand, because you have some very interesting points like on that, we were talking about Amy Edmondson and how she kind of has kind of in a way pioneered, I think you kind of say that kind of way, and you said you were interested in her work. So how do you kind of develop and have you develop that side?
Yeah, so Amy Edmondson and the psychological safety concept. I think this is like the basis that you need to have in organizations and teams for people to be able to take interpersonal risks. Because psychological safety is not that I will be nice to you, you will be nice to me, and that's it. People need to be able to be vulnerable. If there is mistake made, then, you know, in learning culture, we will bring the mistake to the table. We will sit together and see how we can learn from it. But it takes a lot of time. It takes a lot of work to go to that level that people feel okay to say that something is not right.
Yeah, no, because I read something the other day, and it was about that people thought psychological safety just being kind to each other, and it's kind of like going back to your cupcakes. That's like the icing on the cupcake, but the actual cake is creating that atmosphere.
Yes,
like that. Okay, Magda. So I'd just like to move on now to the future of leadership and how you kind of see it like further developing, and is it going to accelerate like even quicker, fragment even more, or do you think it's going to kind of come back into, because everyone I think kind of has their own unique leadership style, and so to kind of label someone as you're a humble leader or you're a servant leader is kind of quite difficult, because everyone has little bits where they're not quite that and not quite this. So from a kind of leadership concept point of view, I think the first thing is, how do you think leadership will develop? And my kind of second question on it is, do you think there's a disconnect between the reality of leadership, for assuming in an assumption, which we don't like to do, but in an assumption between what people kind of think they are, maybe, and kind of the reality of what people are as leaders compared to the theory of leadership? So two questions.
Okay, very interesting. So when you said the future of leadership, the future is now.
Okay.
The future is now, and we need to start looking at now, not what is going to happen in 5 years' time, because you might lose track and you might find yourself behind. So as I say, find the time, stop, embrace, see where you are, what skill set you have, and every leader has a unique skill set and something that you can build on in the future or now, actually. So, since COVID has left us, I would say luckily, COVID left us and we recovered. We've seen a lot of shifts in employees' priorities. People are looking for balance. There is the great resignation, the quiet quitting. Really, the priorities are totally different. And even I've seen approaches in organizations are also shifting. They are looking how they need to adjust the leadership in the organizations to address the well-being or the wellness components for their staff. So I would say, yeah, you need to embrace where you are, what skills you have now, what do you need to develop. And I would say I can see the coaching leadership style is really emerging. So for me, this is something that I will be further developing myself. I will be further developing the skills. I have also embraced, there is another concept of conscious leadership, which is actually very similar. And as you say, there is so many leadership theories.
Yeah.
But there is a common denominator in there. So you need to serve, well, either you're serving the organizations, you're serving your people, and how do you identify yourself? So also I see these days there is a lot of emphasis on how the leaders develop the self-awareness to see these kind of skills, the mental agility and emotional intelligence. Because I can definitely say if I'm not able to manage myself effectively, I cannot go and lead others. Leadership starts with self. I always look at myself, I get the feedback, real feedback, self-reflection.
Yeah.
Also, you need to be able to self-reflect. Look at my toxic traits. We all have toxic traits, at some point in our lives. And if we are able to say, okay, this is something that I need to change, what help do I need? Who do I need to connect with to kind of overcome it, grow it, and have fun. I always say leadership might be a bit serious when you talk about it, but have fun. Because when you have fun, your learning is much more, I would say, accelerated.
Okay, that's great. Thank you very much. Some great answers, some great things to make me even more curious and to go away and think and reflect. And it would be great in the future to have you back on to see how your leadership style's developing and how you're growing. That's amazing. Thank you very much.
Excellent. Thank you so much, Ben. Really, it's been good fun.
It's been very good.